Hello, my name is Michael Kemp. I'm a nurse practitioner student at Maryville University. This is Kim. She's volunteered to participate in this head-to-toe video assessment today. Prior to sitting down here for the assessment, Kim emptied her bladder and I washed my hands, and we did a complete set of vital signs including height, weight, blood pressure, temperature, and also O2 saturation. Starting off here, I'm going to just kind of visually examine the head first from the outside. I'm going to look for any unusual, obvious signs of trauma. I'm going to also check facial features, the eyes, the ears, which all appear to be symmetrical, evenly set, also the nose and the mouth. There's no drooping anywhere, and her skin color is good all the way around. Next, I'm going to go ahead and I'm going to have her do a few things that will check some of the check some of the cranial nerves. First thing is I'm going to ask her to close her eyes really tight, wrinkle up her forehead, puff out her cheeks, smile, smile with show her teeth for me, and stick out her tongue. Okay, good. Next, I'm going to go ahead and I'm going to palpate the scalp here. And I'm looking for any redness, any lesions, any unusual findings. Her hair is nice and soft. I'm also going to check the bone structure here, and that's all good as well. Now I'm going to ask her to keep her mouth closed, but clench her teeth together so I can feel the muscles on the side of the face here. Those are good as well. Next, I'm going to palpate the temporomandibular joint, ask her to open her mouth, and go side to side. And there was no clicking or anything unusual heard there. Next, I'm going to test for sharp and dull sensation. And I'm going to ask him to close her eyes and just tell me whether the sensation she feels is sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay, it was all very good there. While I'm here, before I move into the eyes, the ears, and the mouth, I'm just going to have her shrug her shoulders up to check the 11th cranial nerve, resistant pressure, and that was very good as well. Okay, now moving on to the eyes again, just first visually looking at the symmetry of both eyes. I'm looking at the eyelashes, which are both nice and full on both sides equally. I'm looking at her eyelashes, which are curved up and down on the bottom. I'm going to have her look up for me while I check the sclera and conjunctiva here. Both are really good. I'm also going to palpate the lacrimal apparatus here, and nothing unusual felt there. At this time, I'm also going to just go ahead and palpate the sinuses there. She's going to tell me if she feels any tenderness. Okay. Now moving on, I'm going to test some of the cranial nerves associated with the eyes here. The first thing I'm going to do is I'm going to shine a light into each eye. And what I'm going to be looking for is that the pupil constricts directly, and also that the opposite pupil also constricts. So first direct, and then consensual, and direct, and consensual. And those were both good. Next, I'm going to have Kim follow my finger with her eyes while keeping her head stationary through the 6 cardinal fields of gaze. I'm looking for jerking movements, uneven movements, and none were noted there. Next, I'm going to have her look straight ahead. I'm going to have her cover her right eye first, and then uncover that and cover the left eye. And that's good. There was no jerking movements noted or any unusual movements. Prior to this exam, before she sat down, we had tested her near and her far vision with a Rosenbaum card and also a Snellen chart. Next, I'm going to move on and take a look at the ears here, inspecting the auricle, the pinna for cysts or lesions of any kind here. And both feel nice and healthy. They're both symmetrically set, and the size and shape of both appears pretty equal. Next, I'm going to perform the test the cranial nerve associated with hearing. Number 8, by first striking the tuning fork and placing it on top of her head. She'll tell me if she hears in the left ear, the right ear, or in both ears equally.
Equally.
And that's an expected finding. The next thing I'm going to do is I'm going to strike the tuning fork, place it on the mastoid process, and then ask her to tell me when she can no longer hear it.
Okay, I don't hear it. And done.
And that is also an expected finding. The air conduction should be heard longer than the bone conduction does, and that's how that worked out. Next, I'm going to have her cover one ear at a time while I whisper into the other ear, and she'll tell me if she can hear the word.
Chicago. Blackhawks.
And she did hear that correctly. Moving on from the ears, we're going to inspect the nose, and I'm going to check each side first by pressing the opposite side and having her breathe through each ear one at a time for patency. And the patency of each ear was good. The nose is also in the middle, and I don't see any deviation from the outside. Next, I'm going to go ahead and have her tip her head back, and I'm going to look up inside the nose with the otoscope here, and the nares are nice and healthy looking. No swelling noted. The septum is not deviated inside the nose there. Next, I'm going to move on to the mouth. The first thing I'm going to do is I'm just going to visually inspect the mouth from the outside. Her lips are nice and pink and moist. There's no cracking noted. There's also no drooping of the mouth, and it moved evenly when I was checking the other cranial nerves. Next, I'm going to go ahead and take a look inside the mouth. Have her open up here, lift the back, say ah. As she does that, I noticed that the uvula rises. I looked at the back of the palate and the pillars and tonsils. I'm looking at the upper palate now, and I'm inspecting the gums on the outside here. Also on the bottom. And I'm looking underneath the tongue. No lesions or anything noted there. I'm going to ask her to stick her tongue out, and I'm going to simulate doing a gag reflex by stimulating the back. Kim has a very strong gag reflex and asked me not to do that, but that's how you would do that there. No unusual findings in the mouth were noted. She's got very good teeth, no fillings. So moving on from the mouth now, we're going to assess the neck. And before I do the neck, I'm just going to go ahead and do all of her lymph nodes quickly here, starting with the preauricular, postauricular. Here we lean forward, the occipital. Check the tonsillar, mandibular, submental. Go into deep auricular. And I'm also going to have her lift her arms at this time. Palpate the lymph nodes in the axillary area, epitrochlear nodes. And there was no tenderness, no hard nodes felt at all during that examination. So with the neck again, we're just inspecting the skin on both sides, nice and healthy. Symmetry of the neck is that it's nice and midline. There's no leaning to one side or the other. I'm going to check the trachea here, which is nice and midline. I'm going to feel for the thyroid, below the cricoid process here. Ask her to swallow for me. And the thyroid feels good. There's no nodules detected there. I'm going to palpate each carotid artery one at a time. And then I'm going to go ahead and listen to the carotid arteries and also to the thyroid. No bruise were heard at that time. So now I'm going to have Kim do some range of motion exercises, have her tilt her head forward and backwards to the right shoulder and to the left. Now I'm going to have her resist against my hand, and the same on that side. So that was all very good. Before moving on to the anterior and posterior chest and cardiac assessment, I'm going to just kind of look at her upper extremities here. The skin is nice and healthy all the way down. The development appears to be good on both sides here. I'm going to palpate her hands down here, do capillary refill rates, and those are all nice and brisk. Same on this side. Okay. And the extremities are nice and warm. While I'm here, I'm going to go ahead and feel for the brachial pulse on both sides, and for the radial as well. Moving on to the chest portion of the exam here, I'm going to first just visually inspect the way that Kim is breathing and noting the rise and fall of the chest. It appears equal on both sides. Also on the back side as well, rise and fall of the chest appears to be equal. At this time I'm going to have Kim go ahead and face the wall there, and I'm going to start with the posterior portion of the back and then move around to the anterior side. Again, just visualizing there, nice even expansion of both sides of the chest. I'm going to go ahead and palpate, feeling for anything unusual, no masses or anything. I'm going to assess for pantofrematus by having her say 99 over and over.
99, 99, 99, 99, 99, 99, 99, 99, 99.
And there was no areas of consolidation felt. That felt equal across all the areas of the posterior chest. Now I'm going to go ahead and place my thumbs down here at the costal margin of the 10th rib, and I'm going to ask her to take nice deep breaths. And again, and one more time. And there's nice equal expansion on both sides. Now I'm going to go ahead and percuss for diaphragmatic excursion. I'm going to ask her to lean forward a little bit, cross her arms, take a nice deep breath and hold it. I'm sorry, take a deep breath and blow it out and hold it. Okay, go ahead and just breathe in and out a couple times. And then take in a nice deep breath and hold it. So that area there appears to be about within the 3 to 5 centimeter expected finding there. It's a good finding. So before I go to the front side of the chest, I'm going to go ahead and then just systematically percuss my way up and down both sides. And that completes the posterior portion. I'm now going to have Kim go ahead and turn around to the front here and face me again. As I did on the back side, I will first start with inspection just by looking over. And I've already observed this area. The skin is good in pink. The rise and fall of the chest appears equal on both sides. I'm going to palpate now for tactile frematus as I did on the back side. I'm going to ask her again to repeat.
99, 99, 99, 99, 99, 99.
And before I go any further, I'm just going to go ahead for the cardiac portion of this. I'm going to assess for lifts, thrills, or heaves. And lastly, I'm going to palpate for the PMI. And it's as expected, it's in a midclavicular line there and not off to the side. Before moving on to auscultating, I'm going to go ahead and percuss the chest now. And I'm going to percuss from side to side and then also on the lateral aspects of the chest as well. I'm going to ask him to lift her arms up at this time, and I'm going to go ahead and percuss the lateral aspects. And that's all good. At this time, I'm going to go ahead and first auscultate with the diaphragm of the stethoscope, listening for breath sounds in all fields. Lift your arms up for me. Deep breaths. So at that time when I listened, there was no crackling, wheezing, or any other unusual sounds heard. Now I'm going to auscultate the cardiac sounds, listening for the heart valves, going from aortic to pulmonic to Erb's point to the tricuspid and finally to the mitral. Afterwards, I'll flip over to the bell of the stethoscope and repeat the same pattern. And that was very good. There were no murmurs, no rubs, gallops, or any other unusual cardiac sounds detected there. So at this point, I'm going to have Kim go ahead and lay back, move on to the abdominal portion of the exam. I'm going to put this down a little bit here. Now, before moving on to the abdominal portion of the exam, I'm going to have Kim turn her head to the left side, and I'm going to look for signs of JVD here. And there is no JVD noted here. I'm going to go ahead and lay the table all the way flat, and I'm going to uncover the abdominal area and start the assessment. First thing I'm going to do is I'm going to use some tangential light, and I'm going to look for any unusual striations or pulsations, masses, veins anywhere. And none are noted there. Next, I'm going to auscultate all of the abdominal quadrants. I'm going to listen up to 2 minutes in each quadrant if no bowel sounds are heard. I'm going to use the diaphragm of the stethoscope. Now I'm going to flip to the bell of the stethoscope, and I'm going to listen to the aorta, to the renal arteries, to the iliac arteries, and also to the femoral arteries. And no bruits were detected during that there, which is an expected finding. Now I'm going to percuss the entire abdomen here, listening to changes in dullness. I'm going to try to palpate, to percuss the margins of the liver here. My approximation, I have it about right there, perhaps 6 to 8 centimeters, which would be an expected finding. Also going to percuss on this side for splenic dullness. Okay, and at this time I'm going to perform a light palpation across the abdomen, just looking for any signs of tenderness, discomfort, masses, herniations. Now I'm going to perform a deep palpation across the entire abdomen. Now I'm going to try to feel for the border of the liver. I'm going to ask him to take in a deep breath and blow it out. I was not able to detect it. I'm going to have Kim turn towards me a little bit, well towards me. And again, I'm going to try for the spleen, take a deep breath and blow it out. And was not able to palpate. That's an expected finding. I'm also going to try to palpate the kidneys here. And did not. And no unusual masses or anything also in there at that time. Now I'm going to palpate the iliac arteries and then finally the femoral arteries. And those are all good. Before moving on to the legs, I'm just going to ask him to do a little crunch for me. And I'm going to feel the abdominal muscles here, nice and firm. There's no herniations noted there, nothing unusual. Moving on to the legs now, I'm just kind of visually assessing here. The development of both legs looks equally good here. I'm looking for any unusual hair distribution here. Looking for color of the skin. I'm going to palpate the arteries here. I'm going to feel for the popliteal arteries. There we go. And on this side as well. There we go. And now I'm going to palpate the post-tibial artery on both sides. And finally, check for pedal pulses down here, which are good. Both extremities are nice and warm. There's no signs of edema noted either. This time I'm going to have Kim sit up for me here, edge of the chair. And we're going to go through some musculoskeletal checks here. I'm going to have her put her arms straight out in front of her and try to resist and push down. Go ahead and pull your arms in, pull in, and push out. Okay. Put your arms to your side and try to resist. And now pull down. Moving down to the leg here, I'm also going to have her push out and pull in, push out, and then pull in. That was all very good. Now I'm going to go ahead and I'm going to check her reflexes here. Check the tibial. Oops, I'm missing. There we go. And now the Achilles tendon on both sides. And all her reflexes are good. The last thing I'm going to ask Kim to do is to stand up and just do a slight bend forward. And I'm going to check the spine from the cervical all the way down through the lumbar. There's no bulging or masses, doesn't seem to be any discomfort. I'm also looking at the alignment of the spine, which appears to be nice and straight. There's no bowing or scoliosis. Go ahead and stand up. That concludes this assessment. I thank you for watching and I thank Kim for participating.